to a monthly psychiatric clinic in Suddy. We have opportunities to meet with the University of Guyana, to meet with those who are directly involved in medical and nursing education to find out how we can better collaborate, right, for the ongoing education needs of medical and nursing graduates from the program here in Guyana. And we have a couple of education programs that we've brought with us to share with the medical staff at the Georgetown Public. So it's really a diversity of initiatives that we're
Yeah, because I'm seeing that here in Georgetown, you're in Linden, you're in Suddy, in Essequibo, in New Amsterdam, and also you'll be doing some work with the Georgetown School of Nursing as well, to some extent. In addition to all of that, you're expected to give continuous medical education lectures to medical practitioners. And I'm seeing here delirium. I don't know if I pronounced that correctly.
delirium.
Delirium, sorry, delirium. Thinking of an element in the periodic table. Care to explain that?
Delirium is it's a complication of a medical condition that affects our perception of reality, right? So it affects our attention, our concentration, our sleep-wake cycle, and it can be caused by a myriad of medical conditions. So, probably the most common causes could be the infectious disease. Another common cause is starting a new medication that you've never been exposed to. And it could be something as simple as an antibiotic that you're taking for a bronchitis that for some reason you react to, and suddenly, you're hallucinating, you're misperceiving time. People look at you and they say, "What's going on with you, man? You look different. You're not yourself, right? You called me 3 times this afternoon." So it could be related to lung disease, heart disease, renal disease, heavy metal exposure, intoxication. There's a long list of medical problems that can affect how we think and perceive the world, and that's wrapped up into that term delirium.
So it can pose some challenges then to diagnose specifically.
Absolutely, and that's where you want people with some experience and some training, right? So when someone is misperceiving their reality, is this depression, or is this something like schizophrenia, some kind of substance-related psychotic illness, or is this really related to, dad's COPD or mom's congestive heart failure? And there's a simple medical cause that can be treated quickly, and then the condition reversed.
Hence, I see the need for this kind of lecture in these areas, or lectures. And also, I'm seeing here use of psychotropic in special groups, children, pregnancy, elderly.
Yeah. We brought with us a presentation that particularly looks at the use of medication during the time of pregnancy and breastfeeding, right? It's obviously a critical time for a newborn baby, where we want to limit exposure to medications that can potentially cause problems for the developing baby, right? We want to protect developing babies and breastfeeding babies. And yet we know that there are some women who are pregnant who have long-standing depression, long-standing schizophrenia, and for whom the stress of pregnancy itself is a risk factor of their illness getting worse, right? So we have a dilemma, right? What medications can we safely use? What medications do we need to avoid? And pregnancy happens all over the world all the time, right?
Every day.
About 50% of the time it's unplanned, right? So we recently had this presentation at a Day in Psychiatry education event that we held at Grand River Hospital. It was very well received by the medical practitioners. Had lots of questions afterwards, because medical practitioners ask themselves these questions all the time. This person, she's a young woman, she appears to be depressed. I can start this medication. What happens if she gets pregnant? What do I do then? So that's the kind of practical information that this talk is supposed to present.
Doc, before we go, I feel compelled to ask, because I see number 6 says assessment and management of suicidal behaviors in teenagers, and I get the impression from a layman's standpoint that whenever we talk about suicide, we're talking in some way about mental health. I don't know the correlation between the two. If there is, can you explain that?
Well, suicide is the act or attempted suicide is the act of trying to end one's life, right? Fortunately, completed suicide happens a lot less than attempts at suicide, but suicide does happen in all countries around the world, right? So what brings people to a point where they see that the only option for themselves is to end their life, right? Where they're not thinking about what they're doing at work, they're not thinking about their families, they're not thinking about their community. So the only solution is ending my life. So sometimes that's related to a pre-existing medical illness, major depression. Sometimes it's related to a pre-existing schizophrenia, something like that. But a lot of acts are impulsive, right? It is, a young couple has an argument Friday night, and Saturday the relationship is over, a relationship that's been blossoming for 6 months, right? Marriage was in the offing, and now suddenly it's over. There's a sense of despair and hopelessness, and it leads to an impulsive act, right? A stellar student who has always maintained A+ grades suddenly knows that they're going to come home with a C or a D, and how are they going to tell mom and dad? They can't face that possibility, and in a moment of impulsive despair, they do something that maybe they would regret, right? So suicide is sometimes related specifically to mental illness. Sometimes it's an impulsive act, and when people present to a hospital having tried to hurt themselves, it's difficult to sort out what happened in this situation, right? What brought this person to the place where they thought the only option was to harm themselves? Is there something pre-existing that needs treatment? Is it an impulsive act that if they just are surrounded with caring family and community, they'll be okay? The crisis that precipitated the event is now gone, right? Or do they need some more care? Do they need a safe place for a couple of days? So that's the kind of thing we're talking
And basically, that's what you will cover in this assessment and management of suicidal behaviors in teenagers.
Well,
why teenagers and not generally?
We chose teenagers because teenagers, at least in Canada, perhaps Guyanese youth are more outgoing. Sometimes teenagers are difficult to assess. Doctor comes in a white coat and a tie and says, "Tell me about what brings you here," and you're met with silence or a series of, "I don't know, I don't want to talk." Right? So, because youth are important in all cultures, right? We want to do the best for our youth. We know that it's important to reach out, but they can be a difficult group to reach out to, and so that's the focus of that talk.
All right. Basically, your main focus for this visit here in Guyana, and this is through the Canada Guyana Mental Health Team, is to donate this ECT piece of equipment, and you've done that, and you'll be doing some training. What is it that you may have planned for future visits?
That is certainly our hope, right? That we don't see this as a one-time collaboration. We hope that this becomes a multi-year project, possibly with smaller teams coming back more regularly. And we're hoping to learn more about the possibilities for collaboration, right? So we're meeting with lots of partners within the mental health field, within the medical communities of Georgetown, New Amsterdam. We're meeting with the University of Guyana, who are actively involved in nursing and medical education. What can we contribute to the work that's already being done so that the mental health system in Guyana continues to grow? And part of that, I think, is to look at collaboration with other sectors of Guyanese society. This morning we met with a nonprofit group called the Guyana Foundation, who have an interest in mental health care delivery and transformation of the system. Perhaps there are other nonprofit sectors, or perhaps there are business interests in Guyana that say, we recognize that the mental health care of our population is important. In Canada, Bell Media, one of our major multimedia providers, sponsors an initiative around mental health care, and they had one of our Olympians, Clara Hughes, do a cross Ontario tour, right, highlighting, and she was talking about her own experiences with mental health illness. I think it was depression specifically, right? So we have an Olympian talking about her own struggles with mental health care issues. And we have a major corporate player in Canada putting some money behind that initiative to help break down the walls of stigma.
Maybe we need more of that. And also, I'm told that some of your team members are Guyanese as well. I'm very happy to hear that.
We have 2 Guyanese members on our team. Ram Kalep is a chaplain at the Homewood Health Center in Guelph, which is a private psychiatric hospital. He's been there for 18 years. He's a founding member of this initiative. He comes from the Berbice.
Okay.
And we have a nurse with us, Nadiria Thompson, who, you have to help me. I think her family came from a place called Hog Island. Is that
Hog
correct?
Island.
Hog Island,
Yeah.
yes. And she's a nurse in our long-term specialized mental health unit in Kitchener.
All right, let me congratulate you, and you can convey that to the rest of the team for the good work you have been doing, and we look forward to seeing more of you guys more regularly. And this time you have 19 members, I think?
19 members.
19 members. And so this was a vast increase from last year.
Absolutely.
So we're hoping that we can probably sustain this or have, maybe less as we continue to go along, but at least have a presence over the years. And of course, this is supported by the Ministry of Health and comes under the auspices of the Honorable Minister of Health, Dr. Berry Ramsaran. Dr. Peter Connert, I want to thank you very much. He's a team leader for the Canada-Guyana mental health team here, and they're here to do some work in helping to build capacity to treat mental health here in Guyana. Thank you very much.
Thank you for your time.
Thank you. Nia Saban saying so long until next time.